it's hard to watch someone you care about struggling with mental health issues. You know that if they'd go to therapy, their life would be so much better, but they just won't listen, or you're afraid to even approach them because they're so prickly and defensive about their issues. Well, between the research and my years of experience having these difficult conversations, I've identified an effective 3-step process that helps others become motivated to go to therapy and to take the actions needed to change their lives. They say you can lead a horse to water, but you can't make them drink. Well, that might be true, but today you'll learn my 3-step process to salt the oats. So stay tuned. Welcome back to the podcast. Hello. I'm so happy to have you here. I am your host, Dr. Abby Medcalf. It is my pleasure to be with you here every week and to bring you all the answers, I hope, to all the questions you didn't even know you had, but for sure the questions that you write in and ask me about. Always excited when I hear from you because I know that I'm really hitting what you're wanting. I get a lot of inspiration from the clients I work with and what they're working on and what they struggle with. So that's often part of this, but I just, I couldn't have this relationship without you. So I'm really happy you're here. So I'm going to break down today's teach into 3 steps, and there's a lot to cover today, but I really worked hard on making this as succinct as possible. Because it's such good information. I have talked about the tool I'm going to use before on the podcast, but it's been a long time and I'm definitely bringing it to you, as I always do, in a slightly different way. So there's these 3 steps. First is the prep. That's step 1. Step 2 is then we'll talk about the tools or the meat, I call it, of what we're doing, of the actual process. And lastly, step 3, I'm going to wrap up with some final important tips that really are going to sort of help bring it all together. And I'm very proud. I'm always proud of what I bring you. I am, because I work hard on it to make sure it's really valuable. But I created a new kind of giveaway to go with today's talk about, with specific questions just for today. I know I've done lists of collaborative questions before that you could download, but this is different. So I'll talk about what's different and where you can get, on the website, you can get the download. I'm really excited. It's going to really help you have these conversations on a whole new level. And I'm doing it because, yes, I love you that much. Okay, so let's get to it. Let's get to step 1. Step 1 is the prep, okay? Prepping for this conversation is your absolute first key to success. I've gone deep on prepping for difficult conversations in it. I can think of at least 2 previous episodes off the top of my head. The ever popular how to listen without getting defensive or hurt. It's a great episode. Again, you can search for it on my website if you can't find it on the platform that you're on, listening to the podcast. And I also did one a while ago on how to deal with a defensive person who won't listen. Come on. How good is that one? Let's be real. In those 2, I really went sort of deeper on the prep and other steps you can take other than today, but I'm just letting you know it's there. And, whenever someone wrote in recently that they couldn't find an episode that they were looking for because, like, Spotify, for example, I think they were on, or maybe it was Apple, I'm not sure, but they said they only had like from episode 119 and above, and I have over 200 episodes. So you can always come on over to the website, abbymedcalf.com. All of the episodes are there. All the podcast episodes are there. You can search by topic in the search bar, if you want to know about codependency or if you, whatever, grief or forgiveness or whatever your topic is. And then there's relationship tips and tools, another tab on the website where all of the episodes I do, pretty much all of them except for some of the interviews, have a corresponding blog post under these relationship tips and tools. So you can, if you don't want to listen again to another episode and you just want to, get the cliff notes and go back in, or you like to take notes from the episode, that's a perfect place where you can copy and paste and do all that. Again, I always just try to make it super helpful for you. And why do I do that? Because I love you. Yes, that's why. Because I love you. because we're in a relationship and this is how you act in relationships. So make sure you check out at least those 2 episodes, I would say, to get even more tools for prepping for this kind of conversation, if this is something you really have to focus on. But again, today I'm going to give you just a few tools to get you started. Okay. So the first one in the prep category is to be ready. You got to be in the right mental frame when you're approaching the conversation. So if you're thinking things like, oh, this is going to suck, it's going to be really hard, it's going to be really difficult, they're going to be super defensive, then that's what you're going to get. If you're going in and you're prepared to do battle, guess what? People pick up on that. One or both of you are going to end up hurt and defensive. Right? Remember, we process information, our conscious brains process information at a rate of 50 bits per second. Our subconscious brains process information at a rate of 11 million bits per second. So when you go into a conversation agitated, anxious, worried, whatever, the other person picks up on it 100% of the time. And so now they feel that energy and they're like, because their unconscious is picking up, their subconscious is picking up all these signals you're giving off. So you've got to get yourself straight before you go in. That means you might meditate first. You might just do some mindful breathing. But if you're approaching it like a war, right? Absolutely. But both of you will be on the defensive and you can't have a mutual understanding. Of course, from that place, it's impossible. So get yourself right first. Okay. Get yourself in a good frame of mind. This is going to go well. I love this person. I can make anything happen I put my mind to, whatever. Get yourself right. And then also with your prep is you really have to identify a time and a place. You can't have this conversation on the run or a by the way. That's not the kind of conversation it is. You want to set up a time and a place that makes sense to having a connecting talk. This is a connecting talk. Don't have it at the very end of a long day because you'll both be exhausted. It's, hard to find your mental reserves. Try to be as fresh as possible. And, obviously be mindful as you speak and do all that, but really be mindful about the time of day. And it doesn't mean that you have to say to the person, oh, we have to speak tomorrow at 10. I got a lot to say to you. Obviously that's not going to set it up for success. So instead, you would just look for a time that feels natural and great to have this kind of conversation where, again, a time you're connected. We have to connect to correct. So if we're in a connected place is the best time to have a conversation. I know a lot of people think, well, we're getting along well. I don't want to have it now. Well, guess what? It's the only time to have it. It's the only time to have it. So really do your best to at least you to be in a connected place, right? You to be okay. But if at all possible to also have the two of you in a connected place. And then, you can go in with the, hey, can we talk about something? I have some or I have some questions or some ideas, or I want to brainstorm something with you. That's my favorite. I really want to brainstorm something with you. Are you in a good frame of mind for that? And even that sets it up, which gets me to my next one, which is setting an intention. If you say to someone, hey, do you have time? I really want to brainstorm something with you. That is, to me, the best opener in the world. I just gave you gold right there. You can stop listening now, I guess. Don't stop listening. It's fabulous. There's more. But do you see what happens with that? Can you feel kind of the psychological pull of that where the person's like, yeah, I want to help you. Like they're thinking they're coming in to help you. They're helping you to brainstorm something you have to work out. It's great. It puts somebody in a really great state of mind. And then it's a way of setting intention. It is, but I'd also like you to state your intention out loud. I call setting intention the 18-second shift. It is a game changer. I talk about setting intention a lot. And it's basically, you deciding what's your intention for this conversation. And so it's great to say out loud, it's my intention to listen to with an open heart to everything you say. It's my intention to think about how much I love you and how much I want to understand your point of view in this conversation. It's my intention that we're both going to walk away from this conversation feeling more connected than ever. I'm going to feel heard, you're going to feel heard, and I'm excited about that. It's my intention that we're going to have an even better relationship after this conversation. Hello. Talk about really starting something great, right? And because you have to connect to correct, stating your intention helps everyone involved feel safer and more connected. It's a win-win-win. It's killing a lot of birds with one little stone. If you do nothing else, I would say definitely set intention because it's a big game changer. Okay, so now you're prepped for the meeting. We found our time and place. We're in a good space. We set our intention. We're all feeling the love, okay? Now we get to the meat, step 2. Now we're in the meat. And there is an awesome evidence-based tool that we counselors and mental health professionals use to deal with clients who are resistant or defensive. And it helps motivate them to take action. Okay? So there's a tool we use, that's what this is, to help other people think it was their idea to get help or to do the right thing. And it's called motivational interviewing, or MI, motivational interviewing, or MI. And I've taught this to the federal magistrate judges. I wrote something for one of their journals a few years ago about how to do this from the bench, because it's so important. We know we teach this all around in different formats, especially at like rehabs and hospital discharge people and all kinds of places. And it's based on the work of William Miller and Stephen Rolnick, and this approach has been super well researched, and it's a Substance Abuse and Mental Health Services Administration that's here in the United States. It's called SAMHSA, the Substance Abuse and Mental Health Services Administration. And with them, and they're like the granddaddy of all the research, it's an evidence-based best practice model that they have outlined. That's how much it's been researched. So, and I've been teaching, regular people like you to use these sort of MI tools, these motivational interviewing tools for years. So that you can be effective having conversations where you talk to someone and they get motivated to make the change. Okay. So, and you can imagine why counselors do it, right? We're talking to somebody and we think they need to, or a judge on a bench. He wants someone to choose rehab over going to jail, or to be motivated to follow through on discharge instructions if I'm a discharge nurse at a hospital, or if I'm in a drug rehab and I, want someone to really decide to make a change in their not using drugs and alcohol anymore, or not to leave. Maybe they get a craving and they want to leave treatment against medical advice, and you're trying to convince them not to. There's a million places in counseling where we use this to try to create this dialogue where you're speaking to the other person in such a way that the idea of going to therapy or doing whatever change you want becomes their idea. And when something is their idea, that's when people are motivated to follow through. If I think something is my idea, because it becomes my idea by the way I'm asking questions, I then am going to be motivated. It's my idea. I want to go do this thing. As opposed to feeling controlled or manipulated by you, I'm not so hot to do this thing. And let me just say that right away. You are not manipulating the other person. This isn't about manipulation. This is truly about curiosity and truly about, because you shouldn't be in your head, the only option is that this person stops using, or that this person goes to therapy, or that this person, whatever. I don't want that to be the only option in your head. I want there to be in your head that some help or shift needs to happen, and we need to figure out how. So, and you do that with these specific ways that you ask the questions and the tools that you use in motivational interviewing. So there are a few main tools used in motivational interviewing, and I'm going to teach 3 of them to you today. There's 4 overall, but I'm going to teach 3. So the first tool, and again, you can just do one of these. I mean, you don't have to use all the tools, although they're great in tandem with each other, and I'll talk about that. But this first one is really a key, and that is to ask open-ended questions with the intention of breaking down the other person's resistant thinking and being more open-minded to possibilities. And it's also the intention of you breaking down any resistant thinking you have, because you should be listening to their answers, not just deciding what their answers should be. So again, you might have something in your head and the two of you together come up with a better solution. So, and as I mentioned earlier, I've talked a lot about asking collaborative questions, but the open-ended questions we're talking about today they're different. And these questions are specifically focused on 5 key areas of change, of quote unquote, getting people to change. Okay. So there's a few areas that you have to hit if you want someone to change their behavior. And this is true if you want to turn it on yourself. If you're trying to change something in your own life, this is how you should be doing it. So there's 5 key areas. The first is assessing the other person's readiness to make a change in the first place. How important is it for them to feel happier, sober, confident, stable, whatever lifestyle change you want, right? That's the first. You're assessing that. The second thing you're assessing is their self-efficacy. And self-efficacy means that how confident are you that you can actually make this change? So you're going to be asking questions that specifically ferret out how confident or not the other person is that they can actually make these changes. You know how that is. Maybe you've tried to start eating healthier before, and you've gone on countless diets and you never seem to be able to do it. So when someone's coming to you telling you that you have to change how you eat, or you're going to have a heart attack, or you're going to die, or whatever, or maybe stop smoking, you've tried to stop smoking before, insert bad thing here, thing that's unhealthy here, you start losing the idea that you can even do it. You don't even believe in yourself anymore because you've promised yourself so many times that you'll stop, and you don't. So it's very important to find out where someone is in that world, okay? In that I can't think of the word, in that area. The third thing you're asking questions to get them to talk about change, okay? So this is, again, all these open-ended questions, what you're really doing with these kinds of questions. Here's why they're different than just a collaborative question where I want more, I'm just trying to create a dialogue or more connection. This is something a little more pointed. So I'm asking questions to get them to just talk about change in their lives. So, and I'll give you some examples of this. There might be, how would you like things to be different when it comes to, X? So it depends on why you want this person to go to therapy. Why do you think they need a therapist? When it comes to their energy level, when it comes to their anxiety, when it comes to how they think about their world, when it comes to their happiness, when it comes to their self-confidence. Do you see? It depends on, and which is good. You have to do some thinking, why, because sometimes people don't see a lot of negative impact of their mental health issues. So when you say, well, you're not happy, and they're like, I feel plenty happy, it's a hard thing to come at. So you need to think about what it is. So you want to say, how would you like things to be different when it comes to, and again, it could be your drinking. That's the reason you think they need therapy or whatever. So you can name the thing, but that's going to be important. Or, what do you see as the benefits of going to therapy, getting sober, being more calm, whatever the thing is, right? What do you see as the benefits? What do you think would be a good starting point for you? That's another really good one, right? What do you think would be a good starting point for you? All these are questions to help. Just what we say, how we say it in counseling is to elicit change talk, to get people talking about change, to get the pump primed. That's what you're doing. The fourth area, when you're asking questions, is helping them, and this is huge, develop a discrepancy or a gap between what they're doing and what they say they want. Okay? So, and this is huge. And, questions here could be, what do you see your life looking like if you don't make changes and continue to use drugs or drink or be anxious all the time? How do you see yourself? How do you think your life would be different if you weren't drinking, if you weren't angry so often, if you could pop out of bed in the morning feeling motivated or happier, right? Do you see this? You're amplifying this, you're just making it clearer where this discrepancy is in how they say they want to live, what they say that, because they might be saying, well, I want to get married and I want to have a family and I want all these things. I'm going to cough. Sip of tea. They might be saying all that stuff, but everything they're doing is sitting home alone every night, depressed and drinking. So, they say they want something, but then there's a big discrepancy in what they're doing to make that happen. And when you can not you say, well, you're never going to have this if you keep doing this. That's not it. You're asking a question so they can see that, wow, I'm never going to have this if I keep doing this. That's what you want. We don't learn when people tell us crap. We just don't. In the same way, you're here now learning. You're like, well, you're telling me crap, Abby. I'm learning. It's because you want to. You were here. You are motivated. You are like, right now you're motivated to get someone's ass to therapy. So you're listening hard. That's different than this person who is resistant and doesn't want to do this thing. It's a very different thing. You can't give someone an aha. What motivational interviewing does, what these kind of tools do, is they help the other person have their own aha. And from there, when you have that realization in your head, it starts to click. And that's when you go get help. That's when you do the thing. Okay? And the fifth area, how you're asking questions, is you're trying to amplify their ambivalence, which means you want to help the person see past, they're having contradictory thoughts, and you want to help them see past them. They want to feel better, but they don't want to do anything. When I was trying to get clean, it was like, yeah, I want to give up heroin, but 2 hours later, I didn't want to give up heroin. You know what I mean? You're going back and forth, back and forth. That's ambivalence. And when that's happening, you need to get in there. You have to have some questions to help that ambivalence. So you can ask, like, how is your behavior, and you have to say whatever the behavior is, been a problem to you? How has your drinking been a problem to you? How has your anxiety been a problem to you? If you keep heading down this road, what do you see happening? If you keep drinking, if you keep not leaving your home, if you keep, I had someone write in because they have someone in their lives who's like is hypochondriacal, is a hypochondriac or acting like a hypochondriac. So constantly just focusing on, which is really anxiety, focusing on things wrong physically with them. And so you might ask that, if you keep heading down this road where every other day you have or every week there's something new that you're worried about in your physical health, what do you see happening? How do you see that turning out? Do you see yourself finding a partner who will be okay with that? Do you see yourself, if they already have a partner, do you see yourself staying married, or staying in the relationship when this is a constant struggle? Do you see, you want to really point out that ambivalence. And like I said earlier, I created just for you a really great, wonderful, amazing, I'm very proud of it, handout with multiple questions in each of those 5 categories. So some will be a repeat, but there's a lot of new stuff. I didn't even give you questions for the first couple categories there. So I'll have that as a download. Again, come to the show notes page for the podcast on my website, abbymedcalf.com. Go to the podcast page or the relationship tips and tools page and look at how to convince someone to go to therapy, and you will be able to download it there. You will have to put in your email, and yes, you will. I do not share the list with anyone ever. I'm not sleazy at this point, so stop being paranoid. You will only get my once a week love letter, which is and people love my love letter. They do. I've got my email list eats that up, and they should, because it's wonderful and I love you, and I'm sending you a letter every week to talk about how much I love you in different ways. And all it's meant to be is inspirational and motivational, and to help you think about something, to help you really to think differently. That's all it's meant to do. It's a short read, and if you really don't want that, if you don't want any inspiration during the week, then you can just unsubscribe. It's very easy to unsubscribe. It's not hidden anywhere. It's very simple, because I love you, and that's all it's meant to do. Okay? So come over, download. You're going to love it. It's a really great download. I'm really proud of it. Okay. So we have that. Open-ended questions is the first motivational interviewing tool, and you're asking questions in all of these areas, right? Hopefully that was understandable. And you can download these particular questions to really get good at it. The second tool we're going to discuss are affirmations. And affirmations are just all the, supportive words that make us feel warm and gooey inside. The key here is that you have to be sincere. You have to come up with affirmations you believe. It's really telling the other person the good, healthy things you see them doing or saying, or, what you appreciate about them, that kind of thing. And what happens is when you're, asking maybe one of these, open-ended questions, like, how do you see your life going if this, if you keep using, and maybe the person would say, oh my God, my kids are going to hate me and blah, blah, blah. And this is going to happen and that's going to happen. It's a perfect time to give them an affirmation. Um, you know, uh, you know, I appreciate what a great dad you are and how hard you try to fight through your depression, your drinking, your substance abuse problem every day. Um, that's a beautiful thing to say. Like, I appreciate what a good dad you are and how devoted you are to your kids. It's an affirmation. It has to be true. If you don't think they're a good dad, don't say that. But if you think they're a good dad, you say it. It's a way to, you're bringing the person kind of back from some abyss of like, my life sucks, or all you see is a problem with me. You're validating them because there are always some things that the person is doing to try to help themselves, even if it's hard to see. So you might have to dig a little. I actually said this to someone recently. I said to an acquaintance of mine who was needing some help, I said, you're such a good friend to everyone. You deserve to be a good friend to yourself too. That's a great affirmation. If I do say so myself, haha. No, that was a good one. That's why it just occurred to me, because I was talking to her about, she really needs to get into therapy, but she feels like she doesn't have time or money or all the things. And it's like, but then she spends all kinds of time running around with other people and making sure they're okay and everything else. Her codependency is like DEFCON 5. And so, but she's also is a good friend. And, so I was able to say something really genuine and have her kind of stop and take a look. And then the last tool, the motivational interviewing tool I want to talk about, is summarizing. And this is something you've likely done before. It's when you summarize what you heard and take a guess as to what the other person is trying to say. And the easiest thing to say here is something like, what I hear you saying is. The key is that you would do that. So you'd listen to the other person and say, what I hear you saying is, and then you should ask the person if you got it right, or if they'd like to change anything or add anything that you've restated, because that's really the thing that keeps the conversation moving and showing connection between the two of you. Okay. Now, you have to be on the lookout for signs that the other person isn't listening and they've gone into defensive resistance mode. And these include things like any kind of arguing, if they're challenging you, if they're discounting what you're saying, if they're hostile in any way. Obviously, some sort of overall defensiveness, then you're missing your mark. If they're interrupting you, if they're talking over you, cutting you off, anything like that. If they're denying, if they're blaming, disagreeing, they're excusing, they're minimizing, they're pessimistic, they're reluctant, they're unwilling to change. When you see all that, again, change course. And then my favorite is if people are acting kind of ignorant, they're the non-responsive, the shoulder shrug, I don't know, the non-answer, the no response, the inattention, suddenly they're on their phone or they're somewhere else or they're getting up, the sidetracking the conversation. So and they could also come to you with different kinds of statements, right? I've tried therapy before, it didn't work, it's too expensive, I don't have time. I'm trying to think of the ones that are common. Can I just speak to you when I'm upset? They might be telling you as their friend or something. I feel weird talking to a stranger, they only want your money, all kinds of wonderful things. If you hear or see any of those, so the arguing, any of those statements, the inattention, the ignorance, the defensiveness, if you hear or see any of those, it's time to switch between the tools. It's not time to give up. It's time to switch between them. A healthy dialogue moves between those three tools. So, for example, let's say you start off on a positive note with an affirmation. You say that first, like, you're such a good friend or dad or whatever, or I really appreciate how much effort you put into things when you put your mind to them, or however you start, okay, an affirmation. And then you might ask an open-ended question. But then when you do that, you might find some resistance. Maybe they're defensive or they start arguing with you. So don't stick there. Move to maybe a summarizing statement. So maybe you could say, well, so what I hear you saying is you've tried things before and nothing has helped. And then you would say, is that right? And they would say, yeah, nothing's helped. I've tried lots of stuff before and nothing's helped. And then you might go back to an open-ended question. which might be, is there anything that ever helped even for a minute? Is there anything that, is there any other thing besides therapy you could think of now that could help you shift? Because you could always come back to therapy, or you could find out that therapy maybe is your idea, not theirs. Maybe there's something else. And even then, you might ask another open-ended question and have some other resistance show up. Maybe now they're interrupting you. So again, you might switch to an affirmation. I really, God, you've tried therapy multiple times. You're somebody who really, I've always appreciated about you. You stick to stuff, or you're willing to try things. Maybe they don't stick to it. You're willing to try things. So your key is to be self-aware and take your time. You're not trying. Remember, here's the thing. Your key is remembering you're trying to help, not control. Okay. I know it's hard for me. I'm a control enthusiast. I have a hard time. So you're going to use the 3 things. You're going to come back and forth. You're going to use that list of questions to really help you have a different kind of conversation. So let me go to step 3 now with some final tips, because this is a natural place. Number 1 is don't give up. This is an ongoing discussion. You are likely not going to have one discussion. It's also not a lecture, which means it should be back and forth. It means they should be talking more than you. There you go. I know I stopped you in your tracks. You need to shut up a lot, I say with love, and listen. Ask questions and then listen to the full answer. Don't interrupt them. Don't argue with them. Don't get defensive with them. Make sure you're not resisting, right? It's an ongoing discussion. If your loved one had cancer and didn't want to go to the doctor, I don't think you'd give up so easily. I don't think you'd yell and scream at them. Maybe you would, but make sure you're coming back with love, not your fear. Okay. Make sure your motives are pure. Are you doing this for you or for them? Who is this for? Is it for them to be happy, or that they'll stop being so annoying, right? Remember to do that prep work. This will help you with that, getting in the right place and really feeling like you're in a good spot, in loving place when you're talking to them. Okay. The second thing is, it's okay to use some guilt. And let me clarify though. So I've been known to use my relationship with another person as a kind of loving leverage, right? I'm going to call that loving leverage. So for example, when my mom was alive and, was quite old and living in Florida on her own, and I was living in California, it was first of all, I tried, she wouldn't come live near me. 2, but then I was trying to get care in to help her, and she wouldn't allow it. She would often refuse having a caregiver come in and help her. And, her ego was in the way. She liked that she lived on her own. She used to brag about it. I'm on my own. Nobody takes care of me. And, she was narcissist. So it all was very hard for her to accept any kind of help. And it was all fearful. And she, right? It's all fear-based. And she becomes so obstinate about it. And I would get very frustrated and annoyed. And so finally, I figured out, I started to ask her to let the caregiver come in as a favor to me. I was like, and this wasn't actually true. But it didn't matter. I told her, I'm like, I love you so much. And I'm so anxious. I'm way over here in California, for people in other parts of the world, it's about 3,000 miles away. I don't know that in kilometers, and very far away. Isn't it crazy that the U.S. doesn't do metric? Anyway, don't get me started. I think I was in 2nd grade when they were trying to teach that for a little while, and then totally gave up because we were going to go metric briefly, I think when Jimmy Carter was president or something. Anyway, let me come back. Sorry. The younger people are like, what? Metric here? Who? What? Yeah, we tried it for a minute. It just didn't last. Okay. So here I am with my mom. I'm really worried about her being alone, right? And so, but by asking her to do something for me to make me feel better, she was able to set aside her ego and save face. I'm doing it for my daughter. Oh, I'm going to let this person come in for her. And let me be very clear. I never threatened or gave an ultimatum. I just let her know it would help me in my life. I've done this with my kids when I feel like they've needed something and they were against it, therapy included. I've done it with them too. Like, we're in a relationship together. This is something I need to know you're okay. And I really want you to try this. And I'll actually talk in a minute about how to do that better. So you can use some loving relationship leverage, but make sure it's loving, not fear-based. No ultimatums, no threats, no nothing else. You can just ask that they do it, for the community or the family or for you. And if it doesn't work, it doesn't work, but it's okay to prod in that direction. The third thing I want, little tip, I think I only have 4 tips here, but the third thing I want to say is no diagnosing or labeling. Don't diagnose or label the person you're speaking to. And there's a few ways this is wrong. So first, if the person hasn't been diagnosed yet, you want them to go to therapy and you think, oh, they're bipolar, they need to go to therapy. Calling them bipolar isn't cool. Even if you're a psychologist yourself, you need to have an unbiased professional make the call. Okay. So don't call someone that. But second, even if the person has been diagnosed, they are not bipolar. They're experiencing bipolar symptoms. But, a person is not the label. This is the same as saying that, oh, Susie is motivated. No one is motivated 100% of the time. Susie might be experiencing motivation in a moment, but it's a state, not a trait. Okay, it's a state of being. And there are times with depression, bipolar, anxiety that people are not experiencing those symptoms. Okay, there's times when they're not, and there's times when they are. It's very important and will help with the stigma. It'll help with them being more amenable to getting some kind of treatment. And it's also just the right thing to do. And to stop, again, this is your controlling crap. I say with love, just stop it. So stop using that language. Stop telling them what they are. Okay. The other thing I want to talk about is to think about things being one step at a time. When you get to the place where they are willing to see someone, remember there's still likely going to be some ambivalence for sure. So that back and forth. They don't want to go. When it gets close, maybe they cancel, right? So if you want them to see it, let's say a psychiatrist because you think they need meds, like this happens for me a lot. I'm a psychologist, not a psychiatrist. So I cannot prescribe meds, right? Yeah, here in the United States, I cannot prescribe meds. So I will often think I'm meeting with someone, I'm like, I think they need meds. And I'll mention them seeing a psychiatrist so that they can be assessed. And people can get really weird about that, this kind of stigma, and I don't want to go, and I'm so scared, and I don't want to take medication. And so I make it clear that I'm just asking them to go for an assessment. And I mean that too. I'm not bullshitting. Nothing more. They don't have to take any of the recommendations, right? We're just getting another opinion, and then we can discuss it further. So I just say that. I'm like, I'd like you to have this assessment. The psychiatrist might recommend medications. They might recommend a different kind of therapy. They might recommend a million things. I don't know. But I'd like to hear what they see and hear for you. And then I'll talk to them, or you can talk to them and bring the information back. Usually I like to talk to them. And then you and I talk. What do you want to do next? What do you want to take meds? Do you want to try them? Do you not? Do you want to try a support group? But at least now we have a clearer diagnosis with 2 opinions, and we can really work off of that differently. Okay. Maybe so if you're just wanting someone to see a therapist, like I have had with my kids before, I make it clear that I'm not asking them to commit to long-term therapy. So my thing always, and I do this, sometimes I meet with family members, of my clients or something else. And I just say to them, go 5 times and give it a chance. 5 times. It's not 3. They need to go 5. 5 times to give it a chance. That should be over a month, right? If they go once a week, it's a good amount of time for the therapist to make some kind of real assessment and real attachment either way. And it's a good time for the client to the person, sorry, they're not your client, this friend or loved one, whoever you're trying to get to go, to really see if it's a good fit for them. A lot of therapy is like dating, you sometimes have to really check it out to see if it's a good fit. So, and I always say, if at the end of those 5 sessions, if you don't think this has helped you at all, then let's regroup and brainstorm other options. I don't say then you don't have to go or do anything. I don't say that, because to me, we still have to address this problem, but it just means that maybe we can address it differently. And maybe there's something I haven't thought of that would be a better fit for you versus for me, or versus what I thought you should do. So I think that's it. I thought I had one more in my head, but I really don't. So that's it. I gave you a lot of information today. This is gold. I just want to let you know, in case you don't realize it, because some things can seem simple, but they're not. It is something you're really going to have to practice. These motivational interviewing techniques and tools you want to practice. You can even come download that list of questions and practice them yourself, or tell them, like, I'm going to read from this list because I want to have this conversation well with you, because that's my intention. I'm setting my intention. And I have this list of questions I want to work from, so I know I'm not judging you. I know that I'm really in here trying to figure out something with you, because you know me, I can get a little controlling, and that's not what I'm trying to do here. I love you. I'm trying to figure something out with you. I want to brainstorm with you. And in my experience, people have been relieved, like, oh, okay. And sometimes they'll say, can I see the questions? And you're like, sure, here. Like, it's not a secret. It's not, you can show it to them. Or again, you can memorize a few and have them right there. You could have some on your phone or something and refer to them. Don't be afraid to do that, because this is a skill like anything else. And it's going to take you a little time to get really good at it. I know that things seem to roll off my tongue, right? It's like I've had clients say, oh, it's so easy for you, Abby. You always come up with all these great things to say, because I've been doing this almost 40 years. Of course, I should have freaking good things to say. I would be the worst therapist ever at this point if I wasn't better at this. So don't compare yourself to me. Give yourself a little bit of a break, but do take it seriously and practice and really think about it from that place. Okay, that is it for today. I'm very, very happy you're here with me. I thank you, everyone, for writing in questions around this topic so I could do it. As always, you can write into me. I'm going to be doing different things when I have the membership probably in February, when we start the membership, where, you're going to have access to me to actually ask direct questions live. How cool is that going to be? I know. I'm actually really excited for that. I love just getting the questions and going. I think it's great. I can't really do it in this format. It doesn't work. I can't do it when you email. That doesn't work either. I'm not just giving out free therapy, so please don't write in saying, please give me advice. That's not how it goes. That's not what I'm doing. It's unethical in that forum. It's very different in a different forum when you are in a membership and you're kind of with me for a while, and I can ask more questions and really get more information so that we can have a conversation that really matters. And, when you hear what other people are going through, it really can help you too, because trust me, we all have much of the same issues. Because if you've been listening to the podcast, it's true, because somebody writes in and has an issue and 50 other people have written in with the same one. Guess what? And you're listening now, you probably didn't even write in, and you're like, oh, this is very helpful because it really works. So that's it for this week. I want you to have a lot of patience with yourself this week, a lot of just love, kindness, compassion for yourself and others. I love you. I am sending you such good thoughts right now, and I will see you next week.